I think at a certain point, the more fantastical solution is easier to accept by the patient because they can't understand it, right? I can kind of drown somebody out by using all of the medical jargon and terminology, right? Like I can kind of over-inundate them with all of these, esoteric words that are only really known to the people that are actually in it. And so I can kind of sell you on this, condition that you can't really understand because it takes a lot of training and study to be able to understand all the words. Like even idiopathic, it sounds like a big word, but it means I don't know, right? So you say I have idiopathic neuropathy or an idiopathic disease, and they're like, oh my, and it literally means I don't know, but it's a medical term. So you can give these patients all these medical terms and they can't understand them, so they basically accept the fact that you know better, that you know more, and you're telling them that you can treat it and solve it, and they're just going to basically put their life in your hands because they can't understand it. And I'm not saying the doctor's trying to do that, I'm just saying that basically happens, right? But when you give them this logical rationale of, oh, the nerve that comes out of your back that innervates your bladder, there's a problem with that nerve, and if we take pressure off that nerve, you get better. And no, my doctor didn't say that. And because my doctor didn't say it, and it's really understandable, you can argue with it. You can argue with something that you can understand. You can't really argue with something that you can't understand, right? So now you can argue with it, and if that was the case, why didn't my doctor tell me? And I don't have a great explanation for it. Why didn't my doctor tell me? You can go the pharmacies, the drug companies have really pushed drugs on us as the cure to everything in life, and really doctors have become, in essence, drug pushers. You can go the monetary route, right? You can go the ease of treatment. I think I like that one better. I think it's easier to say, I'm going to give you a pill and you're going to get better. It's easier to say, I'm going to give you an injection and you're going to get better. It's almost easier to say, I'm going to give you surgery and after that day, you will be better. It's harder to say, well, you're going to go through about 4 to 6 weeks of doing a lot of exercises and you'll see gradual but continual improvements, but you're going to have to work at it. That's harder, right? That's harder to sell. That's harder to. It's not as sexy. It's not your quick fix. But for me, it just makes so much more sense. And again, if the medications and injections worked, I wouldn't be here. If the medications and injections worked, everybody would get it, and that would be the end of it. And it's not. Unfortunately, it hasn't been successful, and there's another way to look at it, and the way is simpler, more logical, more linear. But in the same vein, it's easier to argue with, and you can't understand why it wasn't offered to you in the first place.